I'm Colin Richman. I'm a periodontist and I practice in a town of Roswell, Georgia, which is North Atlanta. And I've been offering the LANAP protocol to our patients for about 3.5 years. I've been in periodontal practice for over 30 years. I became familiar with LANAP a good many years ago, and like most periodontists, we are very cautious and show me the evidence. And at that stage there was very little evidence, but a number of my colleagues, and especially directors in Seattle study clubs, and particularly Mark Wilson, were totally thrilled and praising the Perio and the LANAP protocol and the results that they were seeing. And I realized that although we didn't have solid data yet at that time, all of these people who I'm close with and who I trust implicitly, all of them cannot be wrong. Patient acceptance has been almost one of relief that, wow, it's not going to be that full mouth surgery, which I did thousands of cases of, and it might be less invasive, and they're willing to subscribe to treatment quite enthusiastically. In those patients at 3.5 years, they are holding up very well. They are motivated for their hygiene. I will comment. Their hygiene is fastidious, so that's a no-brainer. Their occlusions have been improved. So we are very satisfied. I think the founders of the Perio, the Millennium Organization, really hit the nail on the head when they decided you will be properly trained prior to opening up the box with a laser. I think that's a fantastic strategy. I really appreciated and enjoyed my training. Most of these teeth that have been treated in our office using the LANAP protocol should be there for life. If I were a patient, there is no doubt in my mind this is the way to go. So I would strongly encourage one to take the plunge and do it. As they say at Nike, just do it.